Hi everyone. I'm Sumit Ramani. I'm Executive Committee Member of InsurTech Association. And today we are here to have an interesting session on NABH Digital Health Standards and Digital Mitra Program. While at InsurTech, we do our annual flagship event every year, which is a large organization now with 300 odd members, including insurers, reinsurers, insurtechs, consulting firms. The intention is to bring together the entire insurance ecosystem under one roof, which is what India InsurTech Association has been trying to do for the last several years. Apart from the annual event, we do events like these, where the intention is to spread awareness about initiatives, which could then spawn many projects for insurtechs, wherein they could try and build solutions, which can then help the entire insurance industry. Today is one such session, and we are delighted to have Mr. Avinash here. Mr. Avinash is at the forefront of digital transformation in healthcare. With about 25 years of experience in India, USA, UK, Germany, he has held key positions in Infosys, Quality Care India Limited, and CK Birla Hospitals. At NABH, he leads digital health initiatives, focusing on shaping standards and accelerating adoption of digital solutions, especially in small and mid-sized hospitals, to improve patient safety and care quality. He's passionate about building digital-enabled patient-centric healthcare ecosystems. Mr. Avinash, over to you. The floor is yours.
Thank you, Sumit. Good afternoon, and thank you for the opportunity to speak with the InsurTech community. Today, I'll walk you through how NABH Digital Health Standards are evolving from a traditional accreditation framework into a reliability engine for digital health. And more important, I'll connect this to what matters to you, which is about claims integrity, fraud control, and faster settlements. So I'll just kind of share my PPT. So I'll start with a brief introduction about QCI and NABH. So post liberalization, India needed globally acceptable quality benchmarks, and the Inter-Ministerial Task Force for 1993 recognized this gap, leading to the formation of QCI as a neutral, credible quality institution. QCI was appointed through a cabinet note in 1996. The chairperson of QCI is nominated by the Honorable Prime Minister, and QCI functions under DPIIT, which is the Department for Promotion of Industry and Internal Trade. And we come under RTI and CAG scrutiny, which basically ensures transparency and accountability. Now, the Special Projects Group, it delivers complex nation-level assignments across ministries, ranging from city rankings to impact assessments, translating policy intent into measurable outcomes. Now, each board QCI serves a specialized domain. NABL for labs, NABH for healthcare, NABH for education, NABCB for certification bodies, and they are collectively building India's quality backbone. NABH accredits hospitals, small healthcare organizations, Ayush facilities, imaging centers, blood banks, eye care organizations, primary health centers, and more. So we cover the entire continuum of care. And beyond accreditation, NABH runs certification programs like entry-level, nursing excellence, emergency department certification, and empanelment for CGHS, ECHS, and medical value travel facilitators. So we have, over 20,000 accreditations and certifications and 5,400 plus empanelments. So NABH, we can say is truly Desh ka standard for healthcare quality. And NABH aims to scale quality to 1 lakh plus healthcare organizations while launching new programs in digital health, care homes, stroke care, and dental clinics. So As we speak now, NABH is already engaged with more than 25,000 healthcare providers across the country. Now, the future of healthcare quality is evolving rapidly, right? Now, accreditation itself will increasingly move towards continuous assurance rather than periodic inspections. And digital systems will enable real-time monitoring of quality indicators. Predictive analytics will identify safety risks before harm occurs, and healthcare organizations will operate within the integrated digital ecosystems. So, the shift at scale that needs to take place in healthcare delivery is periodic accreditation to continuous assurance, retrospective review to proactive safety management, and human dependent to system enabled reliability. Now, technology alone does not guarantee better healthcare, right? We will all agree with that. If digital systems are poorly designed, they can even increase complexity. This is why digital health standards are essential. They ensure that technology strengthens clinical processes rather than simply digitizing paperwork, and standards help ensure interoperability, structured data, and safe clinical workflows. Now, if you look at the current scenario, right, systems don't talk to each other, patient data remains fragmented, digital tools remain underutilized, there is variability in quality and safety, cyber and data threats continue to increase, and there is poor ROI on digital investments which the healthcare providers are making. And this is exactly what NABH Digital Health Standards are trying to address. Now, accreditation has played a transformative role in improving healthcare quality. Now, that is established. But the next chapter in healthcare quality is about building high reliability organizations. Organizations where safe care does not depend on individual heroics, but is built into the system itself. Now, standards provide that exact blueprint, and digital transformation provides the engine. So, together, they enable healthcare systems that patients can trust. Because in healthcare, and as all of you would agree, reliability is not a luxury, it is a moral obligation. Now, what makes DHS unique is DHS as in Digital Health Standards of NABH. Now, NABH has achieved something very unique. We have ensured an integrated approach between A is the full accreditation, which focuses on clinical and operations quality. B is the digital health standards for hospitals. And C is the digital health standards for software, which includes HIS, EMR, clinic management systems, risk packs, etc., etc. So when A, B, and C work in harmony, hospitals will get a simplified, future-ready digital ecosystem. In fact, very proud to share that NABH is the first organization globally to operationalize such a unified framework. Now, if you look at the progress that we have made in a very short span of 1.5 years, there are more than 1900 plus applications already for digital health standards for hospitals, out of which 204 are already certified. There are 220 plus hospitals which are undergoing assessments, and we have a pool of 140 plus digital health assessors. Now, coming to digital health standards certification for HIS and EMR, there are 56 applications which are received, out of which 14 are already certified. For 11, the assessments are going on, and we have a decent pool of 24 plus assessors for software as well. So you can, looking to that, you can see that, there is a lot of interest in the industry to apply for digital health standards. 1900 plus hospitals in a span of 1.5 years. I think it's a clear evidence of the interest in the industry to adopt the digital health standards. Coming to the framework, so DHS consists of 38 standards and 182 objective elements. Now, for few of you who may not be, kind of aware of the way NABH standards are structured, there is it is structured as a chapter. There is first a chapter. A chapter is then broken down into standards, and a standard is further broken down into objective elements. So the assessment actually happens at a objective element level. So the DHS, it consists of both the clinical and non-clinical chapters. I will take you briefly through all these chapters as we kind of move ahead. Now, the structure of the standards, all the objective elements, they are divided into core, commitment, achievement, and excellence. And this provides a maturity path for the hospitals. So basically, a hospital can start with basic level of digitization, and then they can mature into adding more clinical depth into the digitization, and then finally they reach a kind of a platinum level where the focus is more on interoperability, clinical decision support, AI based solutions, things like that. So there is a complete maturity pathway which is available for the hospitals. Now, coming to the overview, these chapters cover every digital touch point, which includes clinical, operational, and administrative. Now, let me briefly summarize the 8 chapters. AAC, right, which is Access, Assessment, and Continuity of Care, it includes digital registration, appointments, discharge, lab, radiology, workflows, and also uh, uh, your claims processing. COP includes care of patients, so it includes digital clinical documentation, decision support, and care pathways. Medication management, it includes e-prescriptions, pharmacy digitalization, and interaction alerts, drug-to-drug contraindication alerts, things like that. DIS, which is digital infrastructure, it focuses on cybersecurity, networks, backups, downtime procedures. DOM focuses on workflow automation, dashboards, and process management. FPM, it focuses on finance and procurement, including digital billing, procurement, transparency, auditability. HRM focuses on digital HR system, access control training, and IMS, which is information management, focuses on data quality, privacy, audit trails, and ABDM readiness. So together, these ensure end-to-end digital maturity for a hospital, covering your clinical and operations workflows, your cyber security, your data privacy, and interoperability, including ABDM and NHCX. Now, who can apply? NABH offers both accreditation and certification pathways under DHS. Certification is ideal for hospitals starting the digital adoption journey, whereas accreditation is for hospitals with mature digital systems looking for a comprehensive validation. Now, coming to the impact of digital health standards on hospitals. Now, let's look at the hard numbers, the actual KPI improvements reported by DHS hospitals. So if you look at these numbers, 30% reduction in average reduction in patient waiting time across touchpoints, 100% access achieved for patient records from past and current visits, 39% reduction in TAT for delivery of diagnostic reports, 20% reduction in TAT for patient discharge, 18% reduction in prescription bounces. Prescription bounces is where the doctor is ordered, but the medicine is not available in the pharmacy. 15% reduction in TAT for issue of blood component, and 10% improvement in accuracy in medication administration. Now, the 3 key areas impacted by digital health standards as reported by the DHS certified hospitals are, if I bucket it out into 3, one would be the data privacy and cybersecurity. Now, with rising digitization, I think data governance is critical. Now, DHS aligns with the DPDP Act and enforces role-based access, data minimization, secure storage, backups, and breach notification protocols. And the outcome of it is that it strengthens compliance, mitigates legal exposure, and builds patient trust while safeguarding organization reputation. Second is reduction in the financial risks. Now, DHS minimizes revenue leakage across pharmacy, diagnostics, and admissions. So, when I say admissions, it is basically the conversion ratio, while improving the claims accuracy and reducing the accounts receivable turnaround time. It also optimizes cost of procurement, reduces prescription bounces, and prevents capital lock-in due to inefficient inventory. So additionally, stronger digital engagement, for example, follow-ups, teleconsultation, continuity of care, it reduces the patient migration risk from a hospital. And the outcome is improved margins, stronger cash flows, and better patient retention. And third is patient safety through digitization. Now, DHS enforces accurate clinical documentation, clinical decision support, safe medication practices, and audit trails. It also mandates robust digital patient identification to ensure that correct patient matching is taking place across the care journey, which is, you would have heard of it, several cases of incorrect patient identification happens in hospitals, and DHS helps prevent that. So the outcome is fewer medical errors, improved clinical outcomes, safer care transitions between and within teams, and enhance market credibility. Now, the impact on clinical quality, DHS enforces standardized clinical data capture across providers. Now, this creates longitudinal patient records, better clinical decision making, and measurable quality indicators. Now, for insurers, this means stronger clinical justification for claims and reduced ambiguity in treatment pathways. So ultimately, better care is equal to fewer disputes later. And that is how the DHS helps the insurers also. Now, impact on operational efficiency, DHS digitizes core hospital workflows like appointments, discharge, bed management, pharmacy, lab, and billing. So this reduces manual work, duplication, and turnaround times. Now, if I look at it from an insurance lens, faster documentation leads to faster claim submission, right? And cleaner data leads to quicker adjudication. Now, the impact on patient safety is deeply linked to data reliability. So, DHS ensures accurate EMR documentation, clinical decision support, safe medication processes, and audit trails. And obviously, this reduces the medication errors and misdiagnosis. Now, for insurers, again, lower adverse events leads to fewer high-cost claims and more defensible clinical decisions. Impact on data governance and trust. Now, DHS is fully aligned with the DPDP Act. It mandates role-based access, data minimization, breach protocols, and secure storage. So this builds trust in provider data and legal compliance. And for insurers, confidence in digital record as admissible, auditable evidence. And that's a big, uh, I think, plus from an insurer's perspective. Solving interoperability challenges. Now, as we all are all aware, right, interoperability basically has three layers: semantic, structural, and operational, right? Now, most progress in India has been in the first two layers, which is basically the semantic and the structural layer. Now, the biggest gap is operationalization within the hospitals. And DHS specifically addresses this last mile. And this is critical because interoperability without reliable data is meaningless for claims. Now, DHS, it actually serves as a low barrier technology first entry point, particularly for small and mid-sized hospitals that may perceive full accreditation as complex or resource intensive. So by adopting DHS, hospitals build familiarity with digital governance and documentation, strengthen readiness for NABH entry level or full accreditation, and unlock DHS as a pre-accreditation digital enabler. Now, this is something which you would find interesting. Strengthening health insurance payers against fraud, waste, and abuse through digital health standards. Now, we all know that FWA, which is fraud, waste, and abuse, is a growing concern. Core challenges which insurers face are poor visibility into clinical decisions, variable documentation quality, weak linkages between care and claims, right? Now, DHS creates a trusted digital backbone through traceability, standardization, and transparency. Now, this directly strengthens claim scrutiny and audit capability. Now, let's kind of break it down. Now, if you look at fraud, right, DHS ensures digital patient identity, audit trails, and structured records. Now, the outcome is it eliminates ghost patients and prevents tampering. Now, coming to waste, DHS enables longitudinal records and data sharing across the departments, right? And the outcome again is it reduces duplicate diagnostics and inefficiencies. And coming to abuse, now DHS enforces clinical justification and protocol driven care. And the outcomes are it reduces unnecessary procedures. So the net impact is stronger cost control plus better care discipline. So DHS is not standalone, right? We aligned with the Ayushman Bharat Digital Health Mission, ABDM, NHCX, which is the National Health Claim Exchange, and DPDP Act. So if you look at the bigger picture, better data leading to better claims, leading to faster settlements, which eventually results in lower disputes. And this is exactly where InsurTech and DHS intersect. Now, DHS is supported by a very robust ecosystem. So we have an advisory board, the NABH Digital Health team. We have software testing agencies, we call them Nestas. We have Digital Mitras, which, I have a separate section on that because a part of my a session today also covers the Digital Mitra Program and the assessors. Now, this ensures standard development, implementation support, validation, and audits. So, for insurers, this means consistency across providers and scalability of trust. Now, through structured training, certification, and mentorship, NABH focuses on long-term digital capability creation within the healthcare organizations. So these are some of the multiple training programs that we conduct, apart from awareness sessions that we do on site as well as virtually. Now, one of the most powerful accelerators by NABH is the Digital Health Toolkit, which healthcare providers can leverage for any IT implementation. It provides a very clear roadmap, checklists, vendor evaluation guidance, uh, and a very in-depth, I would say, governance framework, tools, checklist for the implementation phase, go live support, and also a continuous improvement framework. Now, the toolkit ensures hospitals do not waste time, effort, or money. Now, let me come to the Digital Mitra Empanelment Program. Uh, now, let us look at the program, right? So the Mitra program is enabling digital transformation in small and mid-sized healthcare providers. It's a very structured NABH initiative to drive adoption of digital health standards. It focuses on empowering hospitals across India, especially tier 2, 3, 4 cities, basically all non-metro towns, and it is building a trusted ecosystem of digital health enablers. We have conducted three training programs for Digital Mitra empanelment so far, and close to 70 plus digital Mitras are already empaneled. Now let us look at the problem. Why what is the problem which this Digital Mitra is solving? Now the problem is a key bottleneck in India is that small or mid-sized hospitals, they lack digital expertise. Now the challenges include selecting the right HIS EMR, implementation failures, and lack of standards alignment. And the solution for that is the NABH Digital Mitra Program. And the program basically solves this problem by creating a network of trained experts and supporting hospitals end to end. Now, think of this as a standardized digital consultants ensuring digital DHS compliance. So digital Mitras are basically experienced professionals who are trained and certified by NABH. So it is just not individual professionals, even IT organizations can also become digital Mitras. So how the program works is, okay, so there's a eligibility snapshot. I will just pause so that you can read through it. I just give it 10 seconds pause. Okay, so I'll kind of move on now. I'm sure you would have gone through this. Oh. So how does the program work, right? So there is a structured onboarding process which NABH follows. It actually starts with the applicants applying on the NABH portal. Then NABH does a initial screening based on the experience certificates and all which these individual professionals or the organizations have submitted. After that, there is a 3 days of in-person training come assessment, which NABH conducts. So far, we have conducted these trainings in. We started with Mumbai. The second was in Bangalore, and the third was in Hyderabad. So it's a 3 days very intensive training and assessments. And in the training, it is real life example from the hospitals. So case studies, role plays, that kind of training rather than a classroom kind of a based training. And uh, based on the assessment that takes place during the training, NABH then impanels these applicants as provisional empanelment. Now, once the provisional empanelment has happened, then these organizations or individuals are expected to uh, support minimum one hospital to comply with the NABH Digital Health Standards and for them to achieve the certification. Once the certification is through for one hospital, then the provisionally impaneled Digital Mitra become a Digital Mitra of NABH. And once that happens, we put them on our website, and there is a lot of outreach that we conduct for the digital Mitras across the length and breadth of the country. So we basically not just put you on the website, but we conduct a lot of outreach programs where we basically convey to the healthcare providers that if they face any challenge in their IT journey, then NABH has this program, and these are the list of digital Mitras which they can find on their website. So hospitals can directly engage with these digital mitras for any of the IT requirements. And since NABH logo carries that trust factor with the healthcare providers, hence it kind of makes a lot of sense for them to engage with IT consultants who are impaneled by NABH. So this ensures that there is a quality control and that ethical standards are being followed in the process. And if you look at it from an insurer's perspective, more hospitals becoming digitally reliable and faster is exactly what an insurer would want from hospitals, that more hospitals are actually becoming more digitally reliable. Now coming to the value and impact, now the broader impact. Sorry, just excuse me, give me a second please. It accelerates the digital adoption across tier 2, 3, 4 cities. It kind of creates standardization in healthcare IT, and it enables scalable transformation. Now, for insurtech players, you can expand the universe of digitally trustworthy providers, and you can unlock data-driven underwriting and claims model, right? So to summarize, DHS is not just about accreditation, it is about creating a trusted, standardized digital healthcare ecosystem. And for insurers, this translates into reduced fraud, faster claims, and better provider accountability. So the opportunity ahead is to co-create a seamless data-driven claims ecosystem leveraging DHS. Thank you. And so that was a one-way kind of a discourse. And would let's now get into the fun part. Let's kind of uh, understand from each other, hear your views, your queries. So let's make the next section more interactive. So looking forward to hearing from you, your suggestions, your queries.
Mr. Avinash, this is Ravi Kuchumanchi. I have a question related to this, or rather a kind of proposition, right?
Sure.
So in our country, there's a kind of repeat tests, no longitudinal records of patients, because all the IT, hospital IT or healthcare IT is fragmented, right? So how this NABH program is also incentivizing the IT providers, like for example, Manorama Systems or Akil Systems or those who create the EMRs, right? To create that kind of interoperability or build these standards into their softwares.
Okay. So as mentioned earlier, NABH also has digital health standards for HIS and EMR systems, right? And what is happening is a lot of the government tenders that are now coming through for procurement of HIS and EMR, NABH Digital Health Standards is actually becoming a pre-qualifying criteria in itself. So I will break it down. So one is from a government perspective. So government is now all government procurement for HIS and EMR. A lot of the government tenders which have come off late, NABH DHS has become a qualification criteria. That is from a government perspective. Now from a private sector perspective also, the DHS standards for HIS EMR is just around a year old, right? In a way. So what is happening even in private sector is a lot of larger hospitals now in their procurement, they are asking for the certification that, are you NABH certified? Because finally, what we are doing is that the 25,000 hospitals that we have in our already engaged with NABH, we are doing a lot of outreach with those 25,000 hospitals regarding adopting NABH certified HIS and EMR. So that is the work which NABH is doing to popularize the certified HIS and EMR systems in government as well as private sector space. Now, what it's going to lead to is, from an HIS and EMR perspective, is it's going to gradually reach a stage where the customization requirements start reducing, right? It's not going to happen overnight, but over a period of 3 to 5 years, you will see that more and more hospitals uh, deploying NABH standards compliant systems. The HISMR providers also will have a tool, right, to say that, look, we are already adhering to the national standards, and those standards are actually complying with your DHS for hospitals, and the DHS for hospitals in turn complying with a full accreditation. So why do you want us to customize something unnecessary? So gradually, that is what we are already seeing that happen in the industry. And in the next 3 to 5 years, we are hoping that that will lead to a substantial reduction in the customization requirements, which typically get asked from HIS and EMA.
That also saves a lot of money, you're right, for the
Absolutely,
hospitals.
absolutely, absolutely.
Now, do one more question. I mean, I'm curious to know,
Sure.
uh, will it lead to a kind of national EMR so that these health records really become globally longitudinal across the country?
So the idea is not to have one EMR across the country, right? That's never going to happen. And that is where ABDM comes in, right? Because the entire objective of ABDM is to finally make a patient's record in a hospital interoperable, right? So and then basically that would enable creating a PHR for that particular patient. So that is where India is moving to through the ABDM platform. But for ABDM to succeed, it is important that NABH DHS succeeds, because we are the guys who are operationalizing the digital adoption at a individual hospital level. So to answer your question, one EMR is never going to happen, but thanks to the interoperability, the longitudinal patient record will get created, and through the FHIR standards, and that will enable a PHR for the patient. So yes.
Yeah, so that confirms my experience. I mean, even NHS and US health systems could not achieve one national level EMR.
Yeah, I mean, that's the one EMR system is never going to be possible, but through interoperability, definitely the longitudinal patient record uh, would be would be possible. But obviously, it's a journey, right? I mean, because it's not mandate in the country, right? So it's all voluntary in nature. But
Okay.
hospitals are seeing the value, and you can see the ABDM statistics also. There's a lot of improvement year on year with respect to the adoption.
Mhm.
Today is not a Friday evening, right? It is a Thursday evening, if I'm not wrong. I can see complete silence here. It could mean either people are already in the Friday mood.
So we do have a few questions on the chat box. I'll just read it out. So this is from Mr. Ravi. Is NABH accreditation ensure standardization in care delivery across different providers? Today in India, there is a wastage due to repeat testing and sometimes unnecessary diagnostic testing. Will these digital standards ensure interoperability and pave the road for a national level EMR?
He has already answered that question. So
Yeah,
it's okay.
Okay,
this one is already.
there's another one from Mr. Shrikant. Coming from EHR/EMR is background both in US and India. There is stark difference between US and a country like India in adoption of digital health standards. Systems tooling by hospitals, specialty clinics. In US, adoption is directly attached to those hospitals getting the payments in time for the care already provided. It's an indirect incentive towards digital health. What's the incentives that would make NABH DHS push see reasonable success in India in near future?
So let me attempt to answer that. See, end of the day, right? In a country like ours, incentives have a lifespan, right? Uh, and I'll tell you what I mean by that. Look at our full accreditation program, right? Or our entry level certification program. Now, if you look at our full accreditation program, CGHS, ECHS, and PMJ programs, they provide 15% incremental reimbursements if a hospital is NABH fully accredited, right? And for entry level, it is 10%, right? In spite of that incentive, right? Hospitals, there are around 1 lakh hospitals in the country, right? And only 25,000 hospitals over the past 2 decades are on the NABH bandwagon in spite of the incentives, right? End of the day, right, the hospital has to see a value in a product for them to really adopt. Okay. And that is where in digital health standards, we don't really need an incentive. I'm not saying incentives are not going to come through. In fact, PMJ, CGHS, and ECHS, they are in very advanced stages of incentivizing the digital health standards as well. So that is going to happen. But the point that I'm trying to make is that that is not sufficient. End of the day, the hospital has to see value in adopting a digital health standards, right? If they see a value both in terms of monetary benefit and also reduction in patient harm, that is when DHS is actually going to be broad-based in the country. And the good news is that it is already happening. In year and a half, you have 2,000 hospitals who have already applied, 2,000 without any incentive. And what is very gratifying, and you will be glad to hear this, is we have had very small hospitals, less than 50 bedded hospitals from Manipur, from Arunachal, from Jammu and Kashmir, who have actually applied for digital health standards, right? So, what I'm trying to, the point that I'm trying to convey here is that in a country like ours, incentives is not going to be enough. Finally, the hospital has to see the value. And I think DHS, the metrics that I had shown in my slide earlier, wherein the key performance indicators, you see the values moving up and down. That in itself is proving that DHS is actually helping them in reducing financial harm and also patient harm. And that is going to be the key going forward for DHS to be broad-based. Incentives will come, no doubt, but then incentive is not going to be sufficient. It's going to be continuously, value generation from the program. And if you see, other programs in NABH, the new additions come out in 4 years' time, whereas in DHS, it's happening in 2 years, right? And gradually, you never know, we'll actually move it, annually, because you have to continuously evolve the program to meet the needs of the evolving needs of a healthcare provider.
Thanks for the answer, Avinash. Appreciate it.
Yes, sir. In regard to Digital Mitra, what would be the process of submitting application to get scrutinized and go to the process?
Okay. See, for a digital Mitra, what you need to do is you can start by sending an email to dhs@nabh.co. DHS, I'll request my colleague to just type it in the text box. DHS, yeah, dhs@nabh.co. They will guide you to the link through which you can apply. Once you have applied and submitted the required documentation, we conduct an initial screening. There is also a virtual interaction with our subject matter expert committee. Once you have kind of, through that, then, you will get invited for one of the training programs that we conduct regularly. In that training program, it's a 3 days, on-site training program, wherein the evaluation also happens with respect to, the training content. So once you have to, and then there is a project work and all of that. So once, you are past all of that, then you become a professionally impaneled digital Mitra of NABH. So this is the process in a nutshell.
Thank you, sir.
Yeah.
Hi, sir. My name is Milind Dandekar. So here, what I see is there are three different regulatory bodies who will be there managing it. So one is the uh, IT body, which takes care of data, patient data and all. Second is you're talking about insurance. And the third most important thing is the DPDP or the compliance GDP, the DPDP Act, wherein your GRC would kind involve. Would your body take care of licensing with these different regulators to ensure there is a common platform? Because every regulator has his or her way of functioning.
Let me kind of paint a very simple picture for you. It will help you really understand this very simply. See, there is a CDAC and RCS standards. Okay. One is SNOMED. SNOMED is basically the standards for diagnosis. Even there is a SNOMED drug database, which is specially crafted for India. There's an extension of India. So there is SNOMED. Apart from SNOMED, there is the FHIR standard for interoperability, which is the data structure, right? And then there is a line code for labs. So from a standards perspective, there are these three standards which CDAC and RCS, the standards are approved by Ministry of Health and Family Welfare, right? Now, apart from that, the other standard, and if you see ABDM, they basically use both SNOMED and FHIR, correct? Okay. Now the other one is the DPDP Act. Now, what does NABH do is we basically have created the digital standards for digitizing the clinical workflows and operations workflows in our hospital, right? And we have taken into consideration all these standards. We have taken into consideration the CDAC and RCS standards, which is the FHIR and SNOMED and LOI. It is kind of part of our standards. And the DPDP Act also, the ask of the DPDP Act is also included in our digital health standards. So all these regulatory bodies, the different kind of standards that they are all crafted as part of our overall framework. It's already there. And as a result, once we operationalize this in a hospital, right, what we create is we create a digital backbone for a hospital, right? Now, once the digital backbone is created, then ABDM's interoperability kicks in, right? And that is the complete India health data stack. So Am I making sense to you?
Yeah, because there is another piece which also get added is the insurance, where IRDA kind plays a role. Again, some part overlaps with DPTP, but IRDA also plays a role there. I'm more talking from the customer standpoint, meaning not the pharmaceutical or not the drug part, the patient part of it.
You know, I'm not getting your question. What does IRDA got to do with a patient's journey in a hospital apart from the claim processing? You're talking about the claim processing?
I'm talking about the claim because that's where the underwriting and claim.
Understood. But what is that regulatory thing you're talking about?
The way in which the underwriting works for an insurance pertaining to would probably be a particular patient, more than the patient, it will be for the process.
It is
Or
for the insurer. See,
correct.
the underwriting, adjudication, all that is part of the insurance organization's internal process. But we are talking about the digital journey of a patient inside a hospital or outside. We are patient focused. We are not talking about the processes inside an insurance or a TPA. Now, the insurance company is reducing their fraud, waste, and abuse, right?
Yes.
So the outcome of DHS, it basically helps in reduction of the FWA for the insurance companies. But the internal process of insurance company is not something which NABH DHS handles.
Got it, sir.
Got it. That is why, if you see, that is why, you know, be it GIC or be it PMJ or CGHS or ECHS, they're all working towards incentivizing it because they have seen the initial results that have come in, and they've understood that for reduction of FWA, it is important that NABH DHS succeeds. Yeah, so much so, there are two banks also that we are working with. One is ICICI and HDFC on a similar this one. So they are also seeing that comparison of DHS certified hospitals vis-a-vis others, and they're seeing that there is, you know, the initial results are very encouraging.
Okay.
Yeah. I could see another message, I think. Okay, I think we're coming to an end. In case you have any queries, you can obviously put it in the chat box. And
Hello.
Yes, please.
Yeah. So after becoming Digital Mitra empanelment, how to go about how to proceed with the hospital to make it NABH standard? What is the procedure?
No, so basically what will happen is once, you know, you become a Digital Mitra, we will, you know, popularize you and make the hospitals aware that you are a Digital Mitra, right? We also conduct a lot of outreach programs, you know, with hospitals where we invite the Digital Mitras to be part of those awareness programs so that, you know, you are in direct touch. In fact, you know, for example, we do a lot of programs with IMA, we do a lot of programs with CAHO, NABH ourselves, you know, we do 95 awareness sessions every month, 95 on site. So we basically invite all the Digital Mitras and the certified HICMR organizations to be part of this so that, you know, you are directly in touch with the healthcare providers. We popularize you there. We introduce you there. So hospitals, what they do is they directly engage with you. You know, so for example, I'm a hospital, let's say sitting in Baramati, right? And I want, you know, I'm embarking on a digital journey, or I want my hospital DHS certified. So what I'll do is I'll go and see, you know, who are the Digital Mitras, you know, and I'll call 3 or 4, you know, discuss with them regarding the scope, negotiate, finalize one. So that is how this thing works.
Okay, thank you.
Yeah. Okay, so I think we will end this. Shobha, can you please take over now?
Yes, sir. Thank you. So, as I think on the chat also, Dr. Josna has mentioned the email ID. So, for everyone, if you have any queries and you want to take it forward from there, please do send your emails through the email ID that is given in the chat box. And thank you, Mr. Avinash sir, for taking out time to take this webinar. It was an insightful session. So, thank you for your time. And thank you, Dr. Josna, for all your support for the webinar. And thank you, everyone, for attending. I hope this insightful session gives you a lot in detail about NABH. So let's take it forward from there. Thank you.
And thank you to the InsurTech Association for organizing this. It was really a wonderful experience for us, and we look forward to many more. So thank you, InsurTech Association, and the participants who were part of this. Have a great day ahead, all of you. Thank you.